Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
And welcome to Dr. Tom Roselle Live. This is your host for today, Dr. Stephanie Pina. Dr. Roselle is literally swimming with the fishes today. He's somewhere off the Grand Cayman Islands, so he asked us to fill in. And I said us because I am not here alone. I luckily have one of the doctors from the office, and he's going to be your host for this weekend, Dr. Harlan Browning. How are you doing, Dr. Browning?
I'm doing great, and I hope Dr. Roselle's doing well because he needs a vacation now and again.
Yeah, and I think, he's going to get away from all the storm weather that's supposed to be coming in, and he's going to not even know what's going on. It's going to be like 75 and great down there, if not warmer, so... Yeah, I think he deserves it. So we're going to sit in and we're going to talk about some good stuff today. As always, you're more than welcome to call in and ask us any questions. The number for that is 1-888-630-9625. And the topic that Dr. Browning and I are going to be discussing not only today, but also during his in-house educational lecture, which is free, is going to be the treatment of acute and chronic neck and shoulder issues. And I know you are very versed in this, and your lectures are always interesting because you like to get the interactive part going and really get them going there. But why don't you tell us a little bit about it?
Well, I picked this one specifically because coming into springtime because we become more active. We were talking on the way up about me being out in the yard yesterday and raking and do all of those things. So typically this time of year I see people come in the office complaining of neck injuries and shoulder injuries. So hopefully during the course of the lecture we'll give people some strategies on how to prevent these things, and certainly if they're experiencing them right now we'll come up with some treatment plans and some protocols to take care of the problem and fix it.
So definitely a time to start thinking ahead of time versus, waiting till something's happening and then, basically going, okay, I can't work, I can't do anything. How do I fix it now? So, yeah. Yeah,
exactly. And I think for the most part, in what we're missing in medicine is definitely the forethought about preventing things. So a lot of what we do in the office, certainly, and a lot of what I talk about during my lectures is, what can we do to set us up and be in a place where we don't have to experience these different types of problems, and neck and shoulder problems are definitely one of the things that we classically see all the time.
Absolutely. So if you're interested in that, the drill is basically going to be you're going to call the main office, our office at the Roselle Center, at 703-698-7117 to sign up. It's a free lecture, and it's going to be this Wednesday night at 7:30 p.m., and that's going to be Dr. Harlan Browning and talking about neck and shoulder issues. So one of the big things that I always thought, too, is why do you think, from an anatomical and physiological standpoint, that the neck and the shoulder tends to be one of these areas that gets injured so frequently, so easily, and also why is it that we just tend to either hold our stress and stuff in that area as well too?
Well, I think a lot of it has to do with a lot of compensatory things that we do during the course of the day, meaning how we change the way our body works to make things easier. And certainly because the shoulder is so mobile and it has the ability to go in multiple directions, we'll often do things that are outside its normal range. In other words, we'll stress it in different parameters that it's not designed to do, so we can start to develop irritation, inflammation, your tendinitis, which can certainly transition into long-term chronic things. Now, if we have a neck issue, because the shoulder is intricately involved in the way the neck is oriented, what will often happen is we will start to use the larger muscles in the shoulder girdle, specifically the trapezius muscle, and that's the muscle that elevates or lifts our shoulder up and bends our head to the side as well. That muscle will become very active, so a neck problem easily can transition into a shoulder problem and vice versa. And most of the time, like I said, it's just the way we compensate to make life easier for ourselves, but the end product often is aches and pains.
Well, I know we have a lot of patients that come in, and whether they're getting treated chiropractically or they're looking at acupuncture and herbs and also looking at nutrition to decrease inflammation, we have a lot of people who, when they come in, they're looking at a specific area. If they've come in before and said, I've gone to other areas, I've gotten x-rays and MRIs because of this neck pain and stuff, we tend to find it also in other areas because they're not kind of putting two and two together, that the two are basically, connected the way we see it, but they're thinking of it as two separate, completely different issues. How do you try to kind of tell someone and walk someone through that one area like the neck might be really feeding into what they're feeling, any pain going, say, from the shoulder down their arm and vice versa? Well,
you certainly look at the history of the problem. Was there an injury involved? Ideally, if a person has an injury, we kind of try to think about the mechanism that happened, because if we have a blunt force trauma, in other words, something hits us, chances are we've damaged tissue in that area. Now, if a person just has a chronic issue that they can't necessarily pinpoint to a specific event, then we kind of have to open up our diagnosis a little bit, because there's lots of things that generate pain in the body. Certainly we can compress a nerve in the neck, and that's quite common as we get older because we get degeneration or arthritis. Well, we also get pain that emanates from the ligaments and the joints themselves, so that can spread outwards as well. And certainly if we have dysfunction in the muscles or knots or adhesions or what we call trigger points, that can cause pain. The issue becomes a lot of these things overlap, so it can be a little bit tough to tease out what the real problem is. And certainly that becomes harder when we get an x-ray and the x-ray looks relatively good. Mm-hmm.
So, and then from there, figuring out what the best form of treatment is, whether it's more of a nerve or the joint or musculoskeletal type of issue, and how long it's been going on for, and what the person's been using for, treatment on their own or with someone else as well too. So
yeah, certainly, yeah, you're always going to think about the pain component initially, because that's really that's why the person's in your office most of the time, because they're in pain. So what can we do on the short term to reduce the pain and avoid them having to take large amounts of NSAIDs and the Advils and the Tylenols? What can we do to restore the function, rehabilitation-wise, and certainly what can we do on the education side so they don't do it again? Yeah.
So obviously understanding as much as you can about what's going on physically with the body is going to help you prevent things in the long time, and also help you treat them more effectively and know when to go see somebody who knows what they're doing, whether it's neck, shoulder, or the rest of the body as well too. So that's going to be the main topic. That's going to be this Wednesday night, March 19th at 7:30 at the Roselle Center for Healing in Fairfax, Virginia. And one of the other things that we're going to be talking about later, too, is how the rest of the body kind of integrates when we talk about the Ageless Health PBS special, which is coming up, another airing for that as well, which Dr. Browning was featured in as well, too.
And I actually will be at the showing next Saturday.
Sunday?
I think, or Sunday, thank you. I think it's in Reston, correct?
Yes. Well, I'll give more information later on, but it's going to be at the Reston Bowtie Center 11, I think, the one that's right on Market Street in Reston Town Center. Everything's going to be, all the tickets are going to be donated to CFO, which is Caring for Others. It's a nonprofit. And basically, we'll talk about that again. It's going to be directly right after the show, so Dr. Roselle will be joining us at that point, too. So I'll also be there as well, too. So there'll be a few of the doctors that you'll be seeing in the presentation actually on grounds as well, too. Let's talk about, for example, when you look at even a basic anatomy book for the neck and shoulder, there are a lot of intricated small muscles that are involved, not only in the front of the neck, but also in the back of the neck, with a lot of blood vessels and nerves that are getting kind of running in between them, basically. How does that present more of an issue than when, say, someone has a larger joint problem, like when they think about the hip and they think they understand the joint mechanism kind of there, like the ball and socket joint, but they don't think of all these little intricate little things that are going on in that area, unlike the neck and the shoulder?
Well, obviously there's lots of bones in our neck, and these bones are called vertebrae, and they allow us to have normal motion. Well, as we have more motion, unfortunately, it sets us up for greater likelihood of injury. The middle of the cervical spine, the fifth level of the cervical spine specifically, is probably the most mobile, and that's the most likely level to experience injury and degeneration. So, like you said, there's lots of small structures that are in there. Well, because they are all so intertwined, then as one of them starts to fail, then you often will see the surrounding structure starting to fail. Certainly that becomes true in the vertebrae themselves. As one level degenerates, its movement becomes poor, which causes the levels above it and below it to become poor as well, and then they degenerate. And that certainly would explain a lot of the reasons that people getting fusions in their necks or their low backs become failures, because down the road that just makes the other vertebrae move more, and then eventually they break down as well.
Well, one of the things, too, I think we see when patients come in and they've complained of, like, especially neck pain, and there's been an x-ray taken and stuff, posture and what we do on an everyday basis certainly plays part into it. I mean, that's one of the first things that people kind of see is they go, wow, it's either really, really straight or there's enough of a curve in there and stuff, too. When you look at a long-term chronic injury or issue that's going on, do you usually end up kind of addressing their posture from, the neck all the way down, because that's going to play a long-term role in their prevention and in their treatment as well, too?
Yes, you have to look at what they do. How do they sit? How do they sleep? That's a big one. A lot of people sleep on their stomachs. Well, and if you sleep on your stomachs, then you're going to have to turn your head one way or the other to breathe. Well, if you have your head turned for long periods of time while you're sleeping, that's going to put a lot of strain on it. So certainly the way we sit, sleep, stand, the ergonomics at work become a big component as well. So you need to change those things. If a person has a lot of distortion in their posture, in other words, their shoulders are not level when they're standing, or their pelvis is not level, you have to look at that, because the body's main responsibility when it's upright is to fight gravity. And when it doesn't do that well, that comes at the cost of using extra energy and having to recruit muscles to help do that. Well, if those muscles become overactive, specifically in the shoulder or the neck area, then they're going to get knots. And as they get knots, they're going to start to generate pain. So changing the posture ultimately becomes the goal with most chronic things, because there's an adaptation that's taken place, and unless you restore the foundation, then very often the person has these issues that they're on again, off again for long periods.
So just like you're saying with our posture and our sleep positions too, where it just becomes habit to be in there, we typically want to find that comfort spot and just keep going back to it, where it's not always the right mode that we should be thinking of.
Yeah, we have a tendency to move further into what I call the distortion. So if we have an excessive curve in our upper back, it's actually more comfortable for us to make that curve greater as opposed to for us to sit up straight. So, breaking those habits becomes very difficult for people, because there's always a pain component that's involved that tells them there's something wrong, so they're going to try to move away from that pain.
So it's almost as part of what's going on with your treatment. You have to retrain the way you sit, think, sleep, do multiple, repetitive stuff over and over again, not only to prevent other stuff, but to really just help out with what we're doing in the office as well.
Exactly. Yeah, cool. It has to be addressed.
So we're going to be taking phone calls as well here. If you want to call in and talk to either one of us on anything, you can give us a call again at 1-888-630-9625. We're live in the office, sitting in for Dr. Tom Roselle. And basically what we're going to do is talk more about neck and shoulder injuries as we come up on a break in a few minutes. And one of the main things, too, is that whenever we do the in-house educational series, we always have different doctors on the radio show with Dr. Roselle talking about different things. But people are always more than welcome to come in, even if they didn't hear the topic that we talked about the week before. And if they have any questions, stuff, they can always call in or even email us over at the office as well, too. You can go to www.rosellecare.com. And basically send us an email, and we'll be more than happy to answer any questions as well there, whether it's on nutrition and the biochemistry part, the physical part, and the chiropractic and the acupuncture, or if you just got any just general health questions and learning how to prevent health issues or treat stuff that just hasn't been treated properly in the past. So we're going to take a quick break, and then we're going to be back, and we're going to talk some more about neck and shoulder issues.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Bowtie Cinema 11 at Reston Town Center on Sunday, March 23rd at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
All right, and we're back, and it's Dr. Stephanie Pina and Dr. Harlan Browning sitting in the office, in the radio station today. I don't know where I am, but I know we're here. So, but we're going to keep talking about neck and shoulder issues, and one of the main things that people kind of come in all the time for is pain throughout the body, but I think when they come in, they just don't know where things need to start. How am I going to get evaluated and stuff? So, Dr. Browning, why don't you walk us through, that person that's coming in and they maybe had, this going on for a while or a short period of time, and they're just looking for help to begin with. Where does the whole process kind of start?
Certainly, the history gives you a lot of things to work on. When did it start? What makes it better? What makes it worse? Those types of things. The assessment should involve several things. The visual inspection. What does the person look like when they're standing up? Is there asymmetries? In other words, is one shoulder higher than the other? Is muscle groups larger on one side versus the other side? These give you clues that the person might not have had pain for very long, but they probably had a dysfunction that led to the issue. So if we have those asymmetries or changes in posture, what's the quality of the range of motion? Is it equal from side to side, or is there limitations one way versus the other? Is there pain associated with that range of motion, or is there actually noise, what we call crepitation? If a person turns their head side to side and they hear a grinding noise, then that's a pretty good indication that there's degeneration that's taking place. The tissue needs to be looked at. Is there knots? Is the tissue pliable? Does it move smoothly? Is there trigger points in the muscles? Is there adhesions in the fascia, which is more or less the covering that surrounds the muscles? And then, traditionally you go through your orthopedic testing, neurological testing, and then your special tests like x-rays or lab work become a good piece of the puzzle, but we don't want to sell the farm on what we see on the film, because sometimes what we see on the film is not causing the issue. So we want to use the films to help confirm what we already think is happened, and it becomes a great teaching tool, especially with folks that have arthritis, on what we're dealing with here. What does normal structure look like, and what does their structure or their neck look like?
Well, I think you bring up a great point, because essentially, sometimes you do have people come in pain is their number one thing. They just get rid of this, or I haven't been able to get rid of this for a long period of time. But sometimes when you see them, they might not be fully aware of that their posture and stuff is really what's out of whack, that they have muscles that are, like you said, hypertrophied or even atrophied, and then we have to bring that to their awareness to saying the body's just, the compensation factor is really not helping them. So when we look at the patient coming in, you're evaluating not only what you see, but in what they've brought in as far as x-rays and stuff, but also everything else. How does lab work play attention in that? Are you looking for more inflammation type of factors that might be going on that's related to why they're having, neck and shoulder pain, or is there other things as well too that we wouldn't normally think of?
I think lab work can be valuable, especially with the person that has, complaints that are atypical. In other words, the person might describe themselves as having, neck pain, but this is, preceding having a cold or a flu, or a person that might have had a tick bite, and now all of a sudden they have shoulder pain. So the lab work can help confirm if you think that there is a biochemical change that's causing pain, and certainly things like rheumatoid arthritis and the other inflammatory situations like gout can cause these problems as well.
So we see some of the same things, some of these same, like rheumatoid arthritis, gout, like you mentioned, some of these things that we think of other areas of the body, like the big gouty toe, rheumatoid arthritis changes in the hands and stuff. We see this affecting not only the joints that we hear about all the time, but in other small areas too, where they're starting to make small changes that might create something of an issue later on. Right.
Most inflammatory type degenerative disorders have a tendency to go hard at one area, but it's fair game. They can go to other joints as well. We also need to kind of include into this the people that have what we call pain syndromes. And a pain syndrome is something that's not necessarily diagnosable, like a fibromyalgia. There's not a diagnostic test that says, oh, you're positive for fibromyalgia. It's more or less you have inclusion into that diagnosis because you have lots of different symptoms. So people that have these chronic pain syndromes, we do want to have the lab work because there can be metabolic things going on that are certainly sabotaging their biochemistry, which is leading them further down this pathway. So we definitely want to use, the lab work when possible.
And obviously, if we don't address those main causes that's going on, those issues that they're feeling for the pain are really just going to get worse or just stay exactly the same. The treatment's not going to be the most effective thing unless you really address the cause of the biological issues as well.
The treatment is going to basically look at the acute situation. So the person will feel better. The treatment will stop, whatever that is. It could be a rehabilitative therapy. It could be a nutrient or vitamin therapy. But once they stop it, the situation starts to return again because there's no stability in the system or whatever's propagating it or whatever the underlying issue is. It's not been removed, so it's most likely going to come back.
Okay, so we're going to go take another quick break, and we're going to be back, and we're going to talk a little bit about Ageless Health, the PBS special afterwards. And you're here with Dr. Stephanie Pina and Dr. Harlan Browning. We'll be back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back to Dr. Tom Roselle Live. You're in studio here with Dr. Stephanie Pina and Dr. Harlan Browning, and we are talking about neck and shoulder issues and things you can do to prevent them, things you can do to treat them, and things you can find out more information on it. And that is going to be the topic of the in-house lecture of education this Wednesday, March the 19th at 7 p.m. at the Roselle Center for Healing in Fairfax. If you're interested, even though spaces are limited, it's a free lecture, but you want to call to make your reservation, you can give us a call at the number, and the number is 703-698-7117, and essentially sign up for your spot to hear this great lecture given by Dr. Browning. And we actually have a caller on the line. We're going to take that call right now. So Colette from Rockville, how are you doing?
I'm doing fine, thank you. I have a problem with my thumb, trigger thumb. It's been happening since June last year. I did therapy, and then now I'm having the acupuncture.
Okay.
But so far it did not help a lot. My finger now it's like stiff. I can bend it just a little. So I don't know what to do other than that.
Colette, this is
my surgeon is saying that it has to be surgery, but I'm trying to avoid surgery.
Colette, this is Dr. Browning. How did this start? Was there an injury or this?
Injury, yeah. I work in the library in the school system. I was trying to hold the book so that it would not fall down. It just as soon as I tried to hold it, and the book was heavy, I felt that my fingers, my thumb.
Is the pain on the outside of your thumb or the inside? Where exactly in your thumb do you feel the pain?
Inside the thumb. And now, at the bottom of the thumb, it felt like there is like a bone, as if the bone is a little bit swollen or something like that.
And they took X-rays. Did they do an MRI as well?
Yes.
And did you tear any of the tendons or ligaments in your thumb?
It seems that there is a ligament also, tear ligament. Too.
It's completely torn or partially torn?
Partially, probably.
Okay, so partial tear, those things are very treatable. You said you went through rehabilitation and acupuncture as well?
Yes, no, I'm still on acupuncture.
And you said there's also limitations in motion? You can't move it normally compared to the other side?
Yes.
What kinds of things did they do with you in your rehab sessions?
In the physical therapy or hand therapy, they made me to just hold the bottom of my thumb and then lean it down, bend it, and I did that for about 4 sessions, and then stretch my finger, open my thumb, and then down all the way to. So I did that, but didn't help much. Now I'm started with the acupuncture. He did about 5 sessions acupuncture now. He says it's going to take time, but I don't know. I don't feel any.
Well, a couple of things that I would recommend. It sounds like what you were doing with your thumb is called mobilization. In other words, trying to increase the motion. A couple of things that I like to do when I see folks that have either damaged tendons or ligaments, something called a cold laser. It's a laser that emits light, but there's no heat. It has an extremely profound effect on regenerating tissue and controlling inflammation. I really like to use that. And there's different types of tapes that can be used. Kinesio tape is one of them. What the tape does is it re-educates the musculature on when to contract and when to relax, and it provides a little bit of support. As far as the acupuncture is concerned, I know, Dr. Stephanie, you see a lot of trigger fingers and these types of things, and trigger finger is not too far removed from this. It's more or less what happens when the ligament gets injured and down the road these things occur. Yeah,
with the acupuncture, I think what they're trying to do is, one, decrease that inflammation and get more blood flow to the area. What I tend to find when things don't respond very well and then someone's keeping things mobile, they're doing, physical therapy, or they're trying to keep things going, what tends to happen is that you need to look beyond the thumb, beyond where the injury is, because some of those muscles, like we were talking about earlier with the neck, are actually starting to compensate. So they're starting to kind of pull in different areas. And the thumb is a very complex kind of joint as well, too. You can actually start to treat further up the arm and on the other side of the arm as well, too, and that will kind of help release it, too. So it may be something that, as far as the acupuncture goes, less local treatment and more, systemic treatment as well might be more of a benefit. So hopefully we gave you some good information there, but I definitely think when we can combine that with cold laser as well, too. That may not be something that acupuncturist has in their office, but we do it all the time in ours. So
yeah, and certainly if there's clicking and popping in there, then we know that there's adhesions and scar tissue, so soft tissue, techniques, mobilizations, and myofascial release becomes, a pretty important component as well.
Yeah, and then looking also at the structure of any other joints, too, because if you're, like we were talking about, rheumatic arthritis, rheumatoid arthritis affecting the joints, too, and an injury just like that could be what triggers everything and just gets worse after it and slows down the whole healing process as well, too.
And another interesting thing when you're talking about extremities or your feet or your hands or your wrists, there's lots of movable bones in there, and those bones can sometimes lose motion either because of natural causes, as we get older and we degenerate, or because we damage them. So we know that as a chiropractor we manipulate the spine. Well, I think a lot of people don't know that as a chiropractor we also manipulate or mobilize or restore motion in other joints outside the spine. So certainly in the thumb, there's lots of joints that can become fixated and stuck. So manipulation stimulation can be very effective as well.
And that might be something that, looking at a regular x-ray or an MRI, you might not necessarily see anything wrong with the bones and the joints and the tendons there, even though she's saying that she's seeing a partial tear. But they could just still be out of place, creating issues as well, too.
That's correct. So the alignment could be poor, or the movement in between the joints could be poor. So, Colette, if you have any additional questions, feel free to call at the office, 703-698-7117. I'd be more than happy to talk to you or one of the other doctors.
So are you saying that acupuncture is not going to help me much?
No, not necessarily that. I mean, I think that when they were talking about it might take some time, because especially where you're already doing some mobilization, you can move the area, but it's going to take time if there's that partial tear. And so you did the right thing on getting as much of the imaging done and also seeing what the surgeon was saying as far as recommendations. But we've seen partial tears kind of come back, and it's a matter of kind of combining therapies that are going to help out with the healing process and keeping things normal at the same time.
How about surgery then? You don't advise surgery?
Well, I would certainly would exhaust all my conservative options on that before I went in there. Hand surgery can be difficult. How old are you?
68.
Yeah, so I would make sure that you tried to explore all conservative options, and then if you do need surgery, I would look for a hand specialist, not just a general orthopedist, but somebody who specifically does procedures on wrists and hands. So I hope that answers your questions.
All right. Thank you.
Thanks. All right, we're back here live in the studio, and we're going to talk about something fun that's coming up, and it's another premiere. We're going to be watching and showing the Ageless Health special viewing event. This is the event, this is the little movie that we had on PBS about, I guess, a year and a half ago is when they first aired it. And it talks about basically how different patients that have come into the office have responded to different therapies, how they've worked together and really started to integrate the whole triad of health between structural, emotional, and chemical. And the amazing thing is I still remember to this day them coming into the office and shooting that and watching everybody get all dolled up for that and have to go record. But one of the things that we want to talk about, Dr. Browning and I were mentioning this before, is one of the patients that he's involved with on the show, on the special, actually had headaches and some neck issues as well, too. So do you want to just briefly talk about that?
So the movie or the special looked at 5 people with in some cases unique experiences as far as problems, and in other cases typical things. The patient that I was working with had long-standing migraine headaches. Well, it turned out a lot of the reasons he was having these migraine headaches was coming from his cervical spine or his neck. Now, he didn't necessarily have a lot of neck pain, but he had enough dysfunction in his neck and enough irritation at those sensitive nerves that exit there and actually go up to the back of the skull. Those nerves were being irritated and causing his migraine. So by addressing the neck dysfunction, we ultimately corrected the migraine or the headache situation. So it's a pretty good example of kind of looking a little bit outside the box.
Exactly.
Just because this part of the body hurts or that part of the body hurts doesn't necessarily mean that the primary issue is right there.
Well, if you are interested in seeing this, and like I said, Dr. Roselle, Dr. Browning, and myself will actually be there, it's going to be playing at the Reston Town Center's Bowtie Theater. Tickets are going to be $10 each, and you can actually get those on site and actually online if you go to the website www.rosellecare.com. There's a link at the very bottom that brings you to the Ageless Health website, and tickets are $10 per person. All that money is going to go towards Caring for Others, which is the nonprofit 501c charity organization with the mission that helps the sick become well in mind, body, and spirit through natural and alternative care methods, education, and public awareness without drugs and surgery. It's something that we do. We work with this all the time. And essentially you can either show up the day of. It's going to be from 2 to, I believe, 2 p.m. to 4 p.m. It's going to be right after the show. So basically we'll all be running over from the show over to there. And we'll be standing in line and answering questions and be able to see how these 6 extraordinary people were able to make changes not only in their life, but work with a number of different modalities to kind of help create health and wellness in some very extreme situations in some cases and in common situations in other cases too. So it was a Emmy nominated show. So we would like to invite you out there. And like I said, if you need to call the office for more information, you can. That number is at 703-698-7117. Or if you want to sign up to listen to Dr. Browning's lecture this Wednesday night, you can use that same number. Dr. Browning, tell me, and this might be a very easy question.
Hopefully.
I hope so, too. I'm trying to make it easy. You're doing good. I'm doing good. I think Dr. Roselle will be proud of us. When they talk about frozen shoulder, is it really freezing?
Well, not per se in temperature, but it actually is freezing. And by the word freezing, we mean it's losing motion. And from a histological standpoint, histology is the study of the tissue. So if we were to take a microscope and look inside this person's shoulder at their tissues, we would actually see that the ligaments and the capsule, which is a kind of a confluence of a lot of tissue that surrounds the arm bone and keeps it in the joint, is actually shrinking, or it literally freezing up. So as this happens, then it gets shorter and shorter and shorter. As the tissue shortens, we call it creep, then it actually physiologically changes and becomes hard and not very resilient. So then the person experiences certainly pain, then they lose the range of motion. And it's very interesting that very often I see these folks come in with frozen shoulder and they never hurt their shoulder, but when you talk to them, they almost always tell you that they injured their neck 2 months, 4 months, 6 months before it. So as we injure the neck, then we start to do things a little bit different when we move, or maybe we've even irritated some of the nerves that come out of the neck and go to the shoulder. So yeah, frozen shoulder is one of those that very often starts as a neck issue.
And I know one of the other kind of big things that I wanted to ask you too, again, another basic question, but we hear a lot about people tearing rotator cuffs, the rotator cuff, instability. Why is it that, since the rotator cuff's made up of those 4 major muscles there, why do you think those muscles get so much attention and are so difficult to treat or get chronically injured over and over?
Several reasons. We're very anterior dominant. In other words, everything that we do in life is usually in the front of our body, so that involves a lot of the muscles that flex, that bend our arm or roll our shoulder forward. So as we work in the front, then the muscles in the back become weaker over time. As they become weaker, then we lose good orientation of the arm bone, the humerus. And because those small rotator cuff muscles are very involved in stabilizing or keeping that humerus in the joint, they are under a lot of strain, and they become much more prone to injury. Certainly you see the rotator cuff getting beat up over time because of simple things. The way we hold our shoulder when we're at the computer and I'm working on the mouse. I see that a lot. A person has their hand reached all the way out and they're using their mouse all day long, and they will develop a tendonitis, and that tendonitis over time will lead to other issues, and certainly the rotator cuff can get involved.
We get a lot of people that, are looking at issues on that, and so hopefully that at least tells them why that it comes up so commonly as well, too. So we're going to take a quick break, and then we're going to be right back to finish up on the Dr. Tom Roselle Live Show.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
And welcome back to the Dr. Tom Roselle Live Show. You're listening to Dr. Harlan Browning and myself, Dr. Stephanie Pina, tonight. And basically what we've been talking about is neck and shoulder issues and how to treat them, get them diagnosed, and learn how to prevent them. But we're going to take a call that's going to go a little bit south from that. And it sounds like, Joyce, you might have a question on knee pain.
Hello?
Hello, Joyce?
This is Joyce.
Yep.
All right. I'm 85, and I've noticed for years, maybe since I was into my 20s, that my right shoulder is lower. Not that much, but it is lower. And now I'm having problems with my right knee, the collagen, whatever it is, the bones are rubbing. Okay. And I was wondering if I put a heel cushion in my right shoe, because I do favor my right leg, do you think that would bring any relief to me?
Joyce, hi, this is Dr. Browning. You're talking about putting like a little pad under your heel in your shoe?
Exactly, to sort of even out my hip and my shoulder.
Well, if you have a difference in your leg length, which you very well may, because as your knee degenerates, the space between the bones gets closer together, so actually one leg will be functionally shorter. So in some cases, a heel lift can help with the pain. It can definitely help with the way you walk. I don't know how much benefit that will do. I think your best bet is to get some treatment or some therapy on the joint itself, so you can address some of the weaknesses that are probably there, and certainly some of the changes in the way that the joint moves. But very often I use heel lifts with patients that have knee problems, and sometimes I actually will use them with folks that have shoulder problems as well, because if one leg is shorter than the other, then you're going to have to compensate and hold your torso differently, which in many cases can cause excessive stress on the shoulder. So we're going to treat the foot, so to speak, to actually treat the shoulder. But Joyce, I would definitely sit down with your doctor. You could certainly call the office. You need to have that knee really assessed to see what's totally going on, and then put some things into place.
I have gone to an orthopedic doctor, but I go home, all he wants to do is give me a cortisone shot, and I don't want a cortisone shot.
Well, have you done any kind of therapy, any kind of rehabilitative things for your knee?
I have not.
That's the first place that I would think about going. It doesn't sound like he's pushing you into getting a knee replacement, but he's not giving you other options outside the cortisone shot. So, give us a call at the office. We can talk you through some of the things that we would do, but you need to get some therapy on that, and I would do that sooner rather than later, so you can slow down the degeneration.
And you think I should go to a chiropractor for that?
I think that's a great place to start, because we work not only on the joints of the body, but we do a lot of work on the musculature. So, exercise prescription can be put in there. Sometimes we might, again, like you said, use the heel lift as well.
All right. Thank you so very much.
No problem. Great question. So we're going to wrap things up here now. Don't forget to give the office a call to sign up for Dr. Browning's lecture, and also hopefully we'll see you at the Ageless Health premiere next Sunday. Live from us at the studio, Dr. Browning and Dr. Pina himself. We'll see you later.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.